Living with pain, whether it be emotional or physical, is overwhelming and exhausting, especially when it's become chronic. Our systems are designed to respond to acute stressors of physical and emotional pain, to know how to find a space of balance after something happens. But when something keeps happening, such as living with chronic pain or illness, chronic fatigue syndrome, or living in a state of ongoing severe stress, or surviving a traumatic event, our brain doesn't give us the opportunity to come back to self. And over the course of time, that frequently will start to result in a feeling like we are out of control of our mind and body system, that there are forces larger than us guiding the world that we're living in. An analogy I'll frequently use with my patients is, who's driving your boat? Are you in charge of where your boat is going, knowing that, yes, sometimes it gets a little rocky and some storms show up? Or is the world driving your boat and you're sitting there holding on for dear life, hoping that the waves don't throw you overboard? If you're noticing that that second situation feels like your reality, then there's a really powerful new opportunity for leaning in and recognizing that, hey, that's normal. When we're living in chronic stress and emotional pain, physical pain, it feels as though our system is out of control because our little friend Amy the amygdala starts running the show. She starts guiding how the rest of our brain and body system is functioning. Our sense of balance and homeostasis no longer is what we're used to. It gets reset to experience the world through an amygdala-driven lens. And remember, Amy always has our back. She's always looking out for us and wanting to help us make the most empowered, powerful choices we can in our life. And that's the opportunity that our mind-body system gives us. Because when our amygdala resets our experience of the world, she's doing it because she's taking care of us. She's doing it because our mind and body system is needing something different than what is readily available in the moment. And she's going, okay, I'm going to have to use all of our resources to address what feels like a threat. And oftentimes our brain doesn't know that threats in the past are no longer present in the current moment. And that gets in the way of us being present in our current moment because our brain is living in the threat state from the past. So that's the opportunity to start having self-compassion, leaning in with loving care and acknowledging that, okay, my brain is trying to keep me safe, even if these symptoms are hard and painful and exhausting. Taking that step towards self-compassion and understanding in of itself will reduce inflammation. And guess what? Inflammation and stress go hand in hand, and they increase the presence of all of the symptoms that cause us to feel out of control. So self-compassion starts to take that off the table. Loving self-care immediately becomes a game changer. And then there's a whole new opportunity for starting to lean in and look towards, what are the types of neural pathways that you want more of in your life? How can you harness neuroplasticity to create the anchors and have even greater space from what is causing pain and distress? Because when we have those fear amygdala glasses on, those stress glasses, those fatigue glasses, it feels like the entire world is gray. And it's critical that we open up our mind-body system to the rainbow of life, because we can have hard things happening and be feeling hard things and also connect to positive. And that's where that creating possibilities protocol becomes critical, because it creates the space for us to plant some seeds to start beginning to build the world we want to live in.